Laser surgery is very safe these days. It's a very, very good procedure. But like any surgical procedure that we do, it's not perfect, and there are a range of issues that may arise. The first thing is that we're not perfect at making the vision perfect afterwards. But generally we are so close to where we need to be with that people can't tell the difference between what it's like with the laser and what it was like with their glasses or their contact lenses. Almost always, one eye turns out very slightly better than the other one when they're tested individually, but most people aren't aware of that, and generally that's the same with the glasses and contact lenses anyway. Sometimes we are further out with the focus than that. In that situation, then it is feasible to retreat it with the laser to make it better. Now, separate from that, there are things that are real potential problems. Now, the commonest thing, because it affects everybody, is that it makes your eyes more dry. And that's because we affect the nerves in the cornea that create the reflex for producing tears. That takes a long time to recover, and many people need to be using lubricating drops in their eyes for some time. That is more likely to be the case for people who are sitting in front of a computer in an air-conditioned office all the time. But eventually that resolves, and very, very few people have any long-term issues with that. One of the problems that worries us more with the laser procedure is a problem that's called kerectasia. Ectasia means warping out of shape, and there are some people, if we interfere with the cornea too much, then the cornea can warp out of shape. And that's a bad thing because it makes your vision go bad in the way that glasses or soft contact lenses don't fix it, and you have to wear hard contact lenses to get good vision. That is rare, and it is one of the reasons for which we do many of the tests beforehand, is to find people where that may happen so that we don't do it to them. Now, these days there are some other things we can do about that to get around the hard contact lens thing if we need to, but that is a rare event. It is possible to dislodge the LASIK flap afterwards. You have to be pretty careful with it in the first few weeks particularly, that you don't rub your eyes. There are some restrictions on your activity to take that into account. No contact sports for a month, and those sorts of things. But in the long run, to shift that flap, you would have to injure your eye in a way that would damage your eye anyway. It is possible to get an infection with any of the procedures that we do in the eye. We've never seen that with the laser procedures here, but that is a possibility. You do need to be aware that nighttime vision takes longer than daytime vision to be good. Daytime vision is good very, very quickly, but some people are aware of halos at night to start with, and some people would have difficulty driving in the first few weeks at night. But in the long run, we expect nighttime vision to be as good as it was with your glasses or contact lenses beforehand, and sometimes it's actually better. It is possible to get some of the surface cells from the cornea underneath the flap. That's called epithelial ingrowth. And occasionally we have to lift the flap to remove those. That is far less common. In fact, I haven't seen it since we've been using the laser to create the flap rather than the old microkeratome that used to be used for that.